Invoking the blessings of the Almighty and paying our respects to Sadhguru Sri Madhusudan Sai, dignitaries seated on stage, respected elders, doctors, healthcare professionals, delegates, volunteers here, and all those joining us live from around the world, students and staff. A very good evening and welcome to the All India meet of Sai Swasthya Wellness Centers and Sai Arogya Secondary Care Hospitals initiatives of the Sri Madhusudan Sai Institute of Medical Sciences and Research. At the very outset, we would like to welcome all the dignitaries on the dais. Swami Sathya Gyananandaji, Adhyaksh Maharaj of Chennai Ramakrishna Mutt. Dr. Rajyavardhan Azadji, Member of the Legislative Council from Bihar. Dr. Santosh Kumar Kraleti ji, Member, National Medical Commission. Shri B.N. Narsamurthy ji, Chancellor, Shri Sathya Sai University for Human Excellence. And Sadhguru Sri Madhusudan Sai, Founder and CEO, Sri Madhusudan Sai Institute of Medical Sciences and Research, a global humanitarian who's spearheading service initiatives in nutrition, healthcare, and education in over 80 countries. Our hearty welcome to all the dignitaries once again, and we invite all the dignitaries to please come forward to light the lamp, symbolizing an auspicious beginning.
Asato ma sagamaya tamaso ma jyotirgamaya mrityorma amritam Shanti, Shanti, Shanti.
We will commence this evening's session with a Vedic invocation by girl students from the Sri Sathya Sai University for Human Excellence, and they will chant this evening verses from the Brahmanandavalli.
Shri Gurubhyo Namaha Harihi Om Sahana Bhavatu Sahanau Bhunaktu Saha Vidyam Karavavahai Tejasvinavadhitamastu ma vidvishavahai Om Shanti 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 Brahma Vidapnoti Param Tadeshabhyukta Satyam Jnanam Anantam Brahma Yo Veda Nihitam Guhayam Parame Vyoman Soshnute Sarvan Kaman Saha Brahmana Vipashchiteti Tasmad Vaye Tasmadatmana Aka दैवतं प्रतिष्ठा तदप्येष श्लोको भवति ॐ वासुदेवाय विद्महे वैद्यराजाय धीमहि तन्नो धन्वन्तरि प्रचोदयात् ॐ शान्ति शान्ति शान्तिः हरिः ॐ तत्सत् श्री साईश्वरार्पणमस्तु।
The World Health Organization emphasizes the criticality of universal health coverage, which is defined as all people who have access to health services they need, when and where they need, without any financial hardship. Taking a holistic approach to primary, secondary, and tertiary healthcare is essential for any country to achieve the dream of universal health coverage. Dear brothers and sisters, the All India Meet on Sai Swasthya and Sai Arogya convenes as a vital step in actualizing the broader healthcare mission of the Sri Madhusudan Sai Institute of Medical Sciences and Research. As the primary and secondary care wings of Sadhguru's global healthcare mission, these models aim to deliver free, compassionate, and quality healthcare to rural and underserved regions of Bharat. Anchored in the Sustainable Development Goals, the initiative focuses on preventative, promotive, and curative services through a network of the Sai Swasthya Wellness Centers and the Sai Arogya multi-specialty hospitals. These centers are part of the mission's holistic value chain and a larger ecosystem comprising medical education, healthcare delivery, and global centers of tertiary excellence offered entirely free of charge. The meet aims to strengthen implementation models, share best practices, and align all stakeholders in this transformative mission. By combining innovation, community-based outreach, and clinical excellence, these centers are redefining rural healthcare paradigms. Today, we are joined by over 150 doctors, experts, administrators, and volunteers from our national Sai Swasthya and Sai Arogya centers across 9 states, gathered here to contribute to and learn from one another as we collectively define and advance the mission's health goals. Once again, we extend a warm welcome to all the delegates seated here. May we now invite Dr. Raghupati A.R., Director of Medical Education, Sri Madhusudan Sai Institute of Medical Sciences and Research, to deliver the welcome address.
Offering my humble pranams at the lotus feet of our beloved Sadhguru, Madhusudan Sai. Respected Chief Guest, Dr. Rajavardhan Azad ji, a renowned ophthalmologist and MLC of Bihar Legislative Council. Swami Sathya Jnanananda Swami ji of Ramakrishna Math, Chennai. Dr. Santosh, the member, National Medical Council, New Delhi. Dear Chancellor of our university, Sri Nasamurthy sir. Elders and colleagues, dear brothers and sisters of Sai Swasthya and Arogya family, a warm welcome to you all. It is truly a privilege and a joy to stand before you all today. My heart is full as I look at each of you, our team members, who carry the message and mission of compassionate healthcare to the doorsteps of our communities. Today, we gather not just as professionals working in different locations, but as one family, bound together by higher purpose, to serve selflessly, to heal the love, and to walk hand in hand with our people in their times of great need. Let me begin by expressing my deepest gratitude to Sadhguru Sri Madhusudan Sai, whose divine vision and unconditional love have made all of this possible. It is only because of his grace and direction that we are a part of a system that not only cures illness, but restores hope. My dear colleagues of Sai Sathya and Arogya family, you are the first phases of care that patients see. You are the one who meet people when they are anxious, when they are in pain, and when they are unsure of what comes next. You are the bridge between our communities and our hospitals. And your work is not just important, it is sacred. Let me tell you a small story now. Just a few weeks back, I met a woman from a village nearby. Her young child had severe heart condition. She had lost all hope. But someone at Sai Sathya saw the signs, took the time to listen, and guided her to our tertiary hospital center in Muddenahalli. Today, the child has had a successful surgery and is running around, playing and smiling again. The mother came to me with tears in her eyes. She said she did not speak much. She just held my hand and said, "You brought my son back to me." But we all know it was not me. It was all of you who acted quickly with care, with love, and made the right decision at the right time. That is the power of your work. You save lives not just through medicine, but through compassion. This institute, we run a completely free medical college, preparing doctors of tomorrow to serve with integrity and empathy. We are blessed to run a largest chain of pediatric cardiothoracic surgical hospital in the country. Our institutions in Karnataka, Telangana, and Tamil Nadu are nurturing young minds. And through the morning nutrition program, we reach out to lakhs of children, ensuring they do not go to school on an empty stomach. All of this might sound like many different initiatives, but they are all tied together by a single thread, that is selfless service. And that service starts with you, with your smile, with your hands, with your patience, with your faith. Dear brothers and sisters, I urge you, never underestimate the value of what you are doing now. Every time you speak kindly to the patient, every time you comfort a worried family member, every time you guide someone to the right treatment, you are becoming instrument of healing in the hands of divine. Let us continue to serve, hand in hand with the blessings of Sadhguru and with the purest intention of our hearts. Let us continue to uphold this spirit of seva, selfless service, through this Sai Swasthya and Sai Arogya mission. Let us ensure that every interaction is filled with real care, real empathy, and real healing. This conference is our way of bringing you all together, not just to share your experiences and learn from one another, but also to celebrate the incredible impact you are making in the lives of thousands. Thank you for being who you are. Thank you for your service. May we always walk with the path together with love, humility, and surrender. Once again, I welcome you all and look forward to fruitful discussions, new ideas, and renowned inspiration. Thank you, Sai Ram.
Like we've been hearing from morning today, Sai Swasthya has been set up with a vision to take quality and compassionate care to the underserved of Bharat, focusing on 3 pillars of primary health care, which is early detection, care continuum, and timely referrals. We will now have a short video on the Sai Swasthya Wellness Centers highlighting the mission's journey, impact, and the way forward. Can we please have the video? This morning we had technical sessions for all the delegates at the Atai Shaw Hall of the Medical College, wherein doctors and faculty members spoke on medical themes within the care scope of Sai Swasthya and Sai Arogya centers. We will now invite Mr. Shubhajit Roy Mukherjee, Head Northeast Sai Swasthya, to present a summary of the morning session.
Sai Ram. I'm going to share the summary of the discussions held this morning. Around 150 members of the Sai Swasth and Sai Arogya family, doctors, volunteers, administrators, coordinators from 9 states across the country gathered here at Sathya Sai Grama. Day 1 began with a tour of the hospital, after which technical sessions were conducted at the Atai Shaw Hall in the Rajeshwari block. After welcome and a brief introduction about Sadhguru and our mission, healthcare in particular, Dr. Satish Babu outlined the national plan and the goal of this program. The 3 pillars of Sai Swasth, namely early detection, care continuum, and timely referral, were elaborated. Thereafter, there were brief presentations on various clinical aspects of healthcare and management by faculty of the medical college. Dr. Anna Rao Kulkarni from the Department of Public Health spoke about Ayushman Arogya Mandir, our primary healthcare system outlining the importance of equitable, efficient, and effective healthcare. Dr. Akka Mahadevi from the Department of Obstetrics, Gynecology spoke on iron deficiency in women leading to anemia, its causes, consequences, and prevention. A clinical approach for general physicians highlighting the importance of identifying and tackling issues of health by identifying common symptoms in patients was presented by Dr. Naveen N. Dr. Abhishek from the Department of Anesthesia discussed the importance of first aid and its implementation in emergency situations. Further, diagnosis, symptoms, and management of lifestyle diseases such as hypertension and diabetes were discussed. Lastly, the importance and practicality of health education tools such as YouTube videos, which are highly educative and easily available to all, was highlighted by Dr. Nandish from the Department of Public Health. With this, the morning session came to a close. Thank you.
May we now invite Dr. Satish Babu, a renowned endocrinologist, Director of Academics and Strategic Growth, Sri Madhusudan Sai Institute of Medical Sciences and Research, and National Program Lead, Sai Swasthya, to present national plans of our primary and secondary healthcare models.
Sairam, offering our collective salutations at our lotus feet of our beloved Sadhguru, respected dignitaries on the stage, delegates from different parts of the country, faculty, elders, and my dear students. India in last 70 odd years has significantly progressed in many aspects, especially IT and space technology. And recently, there was a demonstration. But healthcare is something which is patchily or disorganizedly developed. I can quote that. So there is a dual crisis which is persistent from a tropical country which sees lot of communicable diseases with progress, with rapid progression of economic development, non-communicable diseases also catching up very rapidly. So this has pushed our population into lot of crisis. 55 million individual families are being pushed to poverty every year, and this is Niti Aayog quote or a study in 2017. So this crisis is getting worse as we move on, and economic aspect of this health crisis is huge and progressively getting worse because non-communicable diseases are getting worse. In 2014, when this study came, diabetes prevalence in India was somewhere around 60 to 65 million. And if you take now, it's 90 million. So you can imagine the economic crisis or economic burden on the nation, on the families, on the individuals. So total non-communicable disease economic loss to nation is 3.5 million according to World Economic Forum study in 2014. So every 10% increase in this non-communicable disease costs 0.5% of annual economic growth of our country. When this is one aspect of spectrum, the other aspect of the spectrum is still communicable diseases, malnutrition, which is poverty driven, are still very significant in our country. And this study in Lancet showed that the proportion of under 5 deaths attributable to malnutrition changed only modestly by 1.8% from 1990 to 2017. When you take healthcare infrastructure, again in last decade, there is rapid, significant improvement. So if you take doctor population ratio, it has improved significantly, 100 for a lakh being WHO standard. India now has 91 doctors per 1 lakh, although there is disparity when you take south to north as demography. When you talk about quality, there are quite a few surrogate indicators to say that our quality of healthcare is in par with any developed country. That is, there is a medical tourism which is very credible and cost effective and made a niche in the industry and earning almost 9 billion into 2025 and estimated to go to 18 billion by 2030. So you can imagine there are centers of excellence which are world class, but at the same time there is a disparity where the health resources are still not accessible to the majority of the population. And you have Indian graduated doctors doing very well in English-speaking developed countries. So why then there is this disparity in India? Is it perpetual? No. If you ask me, if you go back to our own great country's history, our philosophy was Sarve Santu Niramaya, means to say the healthcare was freely available to every citizen of this country and easily accessible as well. This ancient shared responsibility was not sort of privileged. It was for all. What we call in modern days universal healthcare, inclusive healthcare, was practiced as a day-to-day practice. And also there was indigenous healthcare system, very scientific medical knowledge of Ayurveda and wellness science, which is yoga, which is sort of a holistic, comprehensive lifestyle, your life as a science preventing problems. This, of course, this inclusive healthcare and education being free had a broader dimension as well that led to another philosophy of Vasudeva Kutumbakam, which Swami keeps telling, and that's become our way of life as well, our organization's way of life as well. So over a time with invasions, weight of commercialization, monetization and commoditization has changed the way we practice as healthcare service provided to our societies and communities. Until Bhagwan Baba recently gave a breath to this dying philosophy, dying eternal philosophy. And with that inspiration, our own beloved Madhusudan Sai is taken this to next level, and in fact in a very precise and perseverant way. So healthcare, the very simple understanding what he has preached and sort of practicing in our organization is healthcare is never to be sold or bought. And the only sort of a deep solution for this is selflessness. So there are foundations which are being started to bring this change. So the multi-speciality hospital, the multi-speciality hospital is one among that foundation. We have 360-bed teaching hospital and 600-bed hospital coming up. We have 5 cardiac centers across India. Put together, we have almost 1,200 beds and more than 200-250 ICU beds. Outpatient, we see around 3,000 patients per day, and surgeries almost 600. So is this the answer for the Indian problem? No. So preventive and primary health care is the answer, and that's what the new initiative which we have started in last 2 years, taking that philosophy of Sarve Santu Niramaya to the villages, to the single person wherever he is, not being denied of both health access and wellness knowledge. So this is a primary care initiative of Madhusudan Sai Medical College with a vision of making healthcare accessible, comprehensive and compassionate. So the objectives: holistic healthcare, preventive and promotive healthcare, making it accessible and available, with bringing technology both as point of care devices and telemedicine to make specialists reach the remote corners of our villages, and referral system, robust, seamless referral system, so that there is a pathway whenever there is a need for secondary and tertiary care. So this obviously empowers communities. So if you take what services are there in Sai Swasthya Center, mostly it will cover 80% of what the current health requirement is, which is rural, non-communicable disease management program, rural women wellness program, child health program, and of course, when there is a secondary or tertiary healthcare requirement, refer to the surgical units, both Sai Arogyam or to our medical college. So this overall covers comprehensively around 80% of our nation's healthcare issues. So how is this sort of provided as a service? It's a hybrid telemedicine model. You have telemedicine is common across all the centers. You have a nurse-led plus telemedicine center. You have a visiting doctor wherever the footfalls, patient coming to the centers are more. We have a visiting doctor 1 hour, 2 hours coming to sort of nurse who has triaged and kept to be seen by the doctor, physically seen by the doctor. Regular doctor, full-time regular doctor with telemedicine for specialists and referral services. Of course, these are the spokes. Hub would be our medical college, seamless, robust referral system to refer both to Sai Arogya centers which are coming up and tertiary medical college hospital. So being 100th birthday, we are praying for 100 Sai Swasthya wellness centers to be established this year, and we want to screen 1 million population in the rural communities, going door to door for non-communicable diseases, anemia, cataract, visual acuity problems in the children. So this will obviously reduce the disease burden. This is obviously reduce the disease burden by early detection and prevention of common illnesses, decrease the incidence, prevalence of complications, improve maternal and child health outcomes. As I said, referral care. What is the most important part of 55 million being pushed to poverty is out-of-pocket expenditure for secondary, tertiary care, which our non-insured middle class people and poor people being left out. So that is answered, that issue is answered with this referral system, enhanced health literacy and adoption, better health monitoring and mapping, data analytics, so that we can population-wise pick up what is the issues, and as a policy, as a planning, targeted interventions can be planned. Of course, you are strengthening the wellness in the community. So until now, we have 27 centers across different parts of rural India in 9 states. We started in 2023, December 18th, first center was opened. Since then, we have added 27 centers, 85,000 patients have been consulted, and 3 lakh health screenings conducted across these centers, both patients coming to the center and house-to-house visits. So these are the centers in different parts of the country, and yet to come or upcoming centers in next couple of months, which have been processed and in different stages of implementation, are around 25. Sai Arogya hospitals coming up in different parts of the country is another aspect, which is a secondary care model. Last year, December, we opened in Bapatla, a 50-bed hospital. Already in last 3 months, less than 3 months, 35,000 consultations have happened. Inpatient and surgeries are going to be added shortly. So the tertiary center, the numbers you all know, I'll not go into the details, almost nearing 1 million consultations, around 16,000 surgeries, and up to 6,000 deliveries have happened until now. So this model of pyramid model, primary wealth care center, Sai Swasthya center, secondary Arogya centers, and our teaching medical college tertiary center is a unique. I can say no big organizations go for both primary, preventive, and tertiary centers. Either they will be very strong in one aspect, preventive or public health aspect, or they will be in secondary or tertiary care. The organizations which are philanthropic, which are benevolent, will of course think in this way. And Swami keeps telling that no patient should be denied at the early stage of any problem. So and how many beds, how many hospitals are you going to keep building? Prevention is the best solution. So our Sai Swasthya centers will become a sort of foundational aspect in our health mission. And this obviously has to be a collective effort. So I sincerely express my gratitude to all of you who have joined this mission, who have joined the healthcare mission, and only society, institutions, and government joining together can take up this missionary service. And this profound statement holds good eternally, probably. Individually, we are one drop, together we are an ocean. So, with deep reverence and our heartfelt gratitude to our beloved Sadhguru, I thank all of you for your patient listening, and let's join and let's make a difference to what India and the world needs in the healthcare requirement. Thank you.
May we now invite Dr. Santosh Kumar Kraliti, member of the National Medical Commission, to address all of us. Dr. Kraliti is a distinguished public health expert and the founder and CEO of Foot Soldiers for Health. He also serves as professor and associate dean at Rishihood University and has pioneered large-scale health initiatives like Netra Kumbh and Kanti Velugu. With a deep commitment to maternal child health, blindness prevention, and milk banking, he continues to shape national health policies through his roles in key advisory bodies. Dr. Kraliti.
I bow before the lotus feet of Swamiji. Namaskar, Swamiji. And also, Swamiji from Ramakrishna Mutt, my hearty namaskars to you. All the esteemed guests and friends on the dais and off the dais, I'm really blessed to be here today. 2 years back, one of our spiritual mentors, he suggested, he was asking me to come along with him, and I couldn't come on that day. And somehow today, during this doctors' conference, I had to come and be amongst you. I feel it as a divine blessing. Thank you for having me here, Swamiji, and all of you. I am from the National Medical Commission, where we give permissions to medical colleges. We are a regulatory body. Most of the time, we have a policeman's mentality or attitude, a regulatory attitude. We were pleasantly surprised when a team from this institute came to us and said, we want a medical college with 50 seats. Usually there is a clamor to make more money. People ask us 100, then 150, then 200, then 250, and they say, why have you kept a limit of 250? Cannot be 300. But we were surprised when the team came and said, we want only 50. We don't want more than that. Our Honorable Health Minister said, no, please take 100. No, we don't want. We want only 50. We are not here to make money. What kind of an institute? I haven't seen this kind of an institute in whole of India. It was a pleasant surprise. The mentor who told me to come here 2 years back told me, Dr. Santosh, do you know, I visited that hospital doesn't have a cash counter. There's every other department, but there is no accounts department. Which hospital or medical college in this whole country has no accounts department? This is the only hospital and medical college where I found there is no accounts department. Big round of applause for the great work that you people are doing. Many doctors who have spoken before me have said continuum of care, continuum of care. I feel the continuum of care is coming from Sathya Sai Babaji to Madhusudan Sai Babaji. I was a medical college student in Andhra Medical College, Vishakhapatnam. We used to have two very, very divine doctors. Our medicine head of the department, Dr. Gyaneshwar. Dr. Gyaneshwar sir was a walking encyclopedia. And then Dr. Kailash Raoji, who was an orthopedic surgeon and head of the department. Every summer they used to come, and in the train, 100, 150, 200 medical college students used to come to Puttaparthi or Whitefield. And I was one amongst them. It was my luck. It was my divine luck that I came thrice in those wonderful young youthful days, and it had a great impression on my mind. Very recently, in New Delhi, we were conducting World Health Summit in Bharat Mandapam. More than 3,000 delegates had come from across the globe. And most of the times in World Health Organization summits or World Health Summits, usually India is picturized as the slumdog millionaire kind of a picture. We are very poor, we are unfortunate, we are very, very in deep pain, we are in sickness, we are unhealthy, unfortunate. And we ask all the other countries of the globe, can you give us some dakshina or something in the World Health Summit? But we were surprised in this time in the World Health Summit, India's one of the best healthcare examples were showcased. It was under the leadership of the current Prime Minister and current Health Minister. What all good is happening in this country, how it can be shared across the globe. Our denominator itself is so big, 140 crores, 1400 million people. Which country other than China has so many people in this world with so many languages? China is different. It is not a democracy, it's an autocracy. We are a democracy and 1400 million people, so many languages, so many different festivals, different foods, from aloo paratha to idli. So we have so many variations, but still We have done so well in last few years. When we got freedom, our average life expectancy was 37 years. Today it is 68. Today it is 68. We have made a huge difference. 26% of the doctors who are working in UK are from India. 26%. One of the doctors just now spoke. In most of the English-speaking countries we are working. 18% of US health force is Indian doctors. So in one of the meetings with the Prime Minister in National Medical Commission, when we were discussing, we were talking and asking, requesting him, I think we are starting too many medical colleges. We must decrease the number of colleges and we must not have as many as 600 or 650. Because now we have reached 1 per 1,000. The secret formula or the ratio we have reached. Then the Prime Minister said, Indian doctors are not for India, they are for the globe. They are for the whole world. We are just now working in US, UK, probably in Canada, Australia, New Zealand. But what about Africa? What about those countries where the healthcare requirements are as important as Indian rural and tribal areas? So I think we need to provide first and best quality doctors and medical treatment for the whole world. And I am seeing that kind of quality in this medical college. Today I went around speaking to some of the medical college students, some of the departments. I couldn't visit the whole hospital, but I visited the obstetrics and the neonatology and pediatrics department. I was very happy that one student from Haryana who could not pay for a private medical college fee came and joined in this medical college because it is giving everything free of cost. Can you believe medical education being provided free of cost by a private institute like this? How much does it cost? More importantly, what big heart you need to have to give education free of cost. In medical education, this is stupendous work. I have not seen this anywhere else. And I visited obstetrics and pediatrics departments, and I wanted to give some suggestions, but I saw the team there. They were very compassionate. I wanted to tell and understand how the clinical practice is. I saw that a C-section lady who had a cesarean section yesterday had breastfed her baby on the same day after C-section. So the baby and the mother are not separate and they are not in ICU or somewhere, and some of the best protocols are being followed in the hospital. So I really loved visiting the obstetrics and neonatology department. There is always scope for improvement. There is always centers of excellence that can be built. But a medical college which has started just 2 years back, I think you have made a lot of progress. And that shows the dedication, that shows the inspiration that the teachers, the faculty, the doctors, everyone here is actually very, very inspiring for the next generation. I was talking about our medical college days. Our medical college days, we never were taught about yoga, we were never taught about meditation, we were not taught about happiness and spirituality. We never knew all this until and unless we came across either Ramakrishna Mutt or Sathya Sai Baba or probably Rashtriya Swayamsevak Sangh. These were the three organizations which actually brought some amount of patriotism and discipline and these sort of things. We used to study in the library till 4 in the midnight and then have coffee and then used to sleep. There was no circadian rhythm. There was irregular rhythm. just like our heartbeat sometimes. Any day anything can happen, some days it can happen, some days it doesn't happen. But here I was really, really surprised to look at the happiness. Very recently in the World Health Summit, we were discussing about redeeming the spirit of medicine through healing and learning. Redeeming the spirit of medicine. How to bring happiness. How to improve patient outcomes. The patient outcomes can be improved only if the doctors and the medical fraternity are happy. If you see in our labor rooms, and today I was looking at the labor room here, spick and spanky, very clean, no smell, excellent in the labor room. And you are conducting 200 deliveries a month in this area. I mean, how much community work and public health work would have happened. I was so happy to see. In our labor rooms, we used to see mothers being abused. You would have all experienced government hospitals. Why did you get married? Sometimes, these sort of things. Why did you come here? So when you listen to these sort of things, automatically you also get trained like that. There is no joy in delivering healthcare. But here, you see the joy, happiness, spirituality. I think this is very, very key. How a doctor is trained. How a healthcare worker is trained. If the doctor and healthcare worker is trained with happiness, with spirituality, then that is what he delivers. What you sow, you reap the same thing. It is very, very important that we bring happiness. We were thinking about a very, very new concept of spiritual quotient in accreditation of hospitals. How do you bring spirituality? Only one country has experimented all over the globe. It is Thailand. Thailand, in their accreditation matrix, they have spirituality. How many hours a doctor had meditated, a staff nurse has meditated, a counselor has meditated, or has done spiritual work, seva, selfless work. And I think that is one of the most important component that can bring happiness in the healthcare worker, in the force. And that is what I am seeing here. Wonderful, very happy faces, very welcoming, and very, very large-hearted people. Very big round of applause to all the healthcare workers who have assembled here. I used to go to RSS Shakha. In our Shakha there was a shloka called Natvaham Kamaye Rajyam Na Sukham Na Punarbhavam Kamaye Dukkha Taptanam Praninam Artinashanam. I don't want Swarga, I don't want relief from Punarjanma. What I want is that these Dina, Dukkha, people who are there, their pain has to be relieved. And that is what I am finding in this wonderful institute and hospital and medical college, and I am really, really blessed to be here. Praninam Artinashanam. Their Arti has to be removed. I am sure our Prime Minister's dream, our Health Minister's dream, our nation's dream of Vasudaika Kutumbakam, of serving the whole humanity, of being the center for seva for the whole world is going to be met by this center. I think one of this very, very important pillar. I was speaking to the students. There was a doctor called Dr. Dwarkanath Kotnis who went and served in China during Chinese-Japanese wars. And if the Chinese premier comes to India, he first goes to Mumbai to pay homage to him before meeting any president or prime minister. I think that is the bigger message. I think the world over, this institute, many, many Dr. Dwarkanath Kotnises will be produced from this institute, I believe. Now, a few things which I wanted to share about the whole model of pyramidal structure model which Dr. Satish ji has explained very well. Annually 3% of our population is becoming poor. Because middle class people do not have Ayushman Bharat. Only poor people have. How do people become poor? By out-of-pocket expenditure. And how does this out-of-pocket expenditure happen? If it is a catastrophic health expenditure. What is catastrophic health expenditure? More than 25% of their annual earnings, if they are spent within 1 month, it is called catastrophic health expenditure. For example, an accident, a cancer, a heart attack, a surgery, a stroke, something of this sort. They are APL, above poverty line. So Ayushman Bharat doesn't cover them. And once they have this catastrophic health expenditure, they become BPL. 3% of APL every year become BPL because of this catastrophic health expenditure. And it is very, very important that we have tertiary care and secondary care services free of cost for even middle class people. It is very, very important. And also in the BPL, the lowermost strata usually do not have any coverage. They don't have Aadhaar cards, they don't have ration cards, they don't have any card. They don't know how to get a card because they are literally very, very poor. For example, the Chenchu tribes or some other tribes in tribal areas, they don't know how to do that. Yanadis, Yerukula, these tribes. So I think those people are the most vulnerable. And I think we require, just government alone cannot solve these issues. And we require organizations, institutions, hospitals like this wonderful Madhusudan Sai hospital which is out here. I think it is very, very key to address that gap in our health system. And as rightly pointed out by Dr. Satish ji, we are walking on a double-edged sword. On one side we have NCDs, on other side we have CDs, communicable diseases. The very, very peculiar problem because our denominator is very high, 140 crore people, 1400 million people. So it's very, very big population that we have to serve. And I think big problems require bigger solutions. And the bigger solution is this pyramidal model which you have designed. I was surprised, I was talking to our director Saab, Dr. Raghupati ji, that Swamiji his vision is more than a health minister. More than a health minister. Because primary care, secondary care, tertiary care, promotive, preventive, curative, this is the exact model which we designed during the first health policy that was written in this country, and still we are not able to achieve. Because government alone cannot solve this issue. We require a people's movement in this. And I think that is what is happening. I'm really, really happy. And I think another biggest problem today I learned, Annapurna, the program which you are doing is a remarkable program solving the nutrition. I also have a small nutrition background. We run a chain of mothers' milk banks where we actually collect donated mother's milk, pasteurize it and give to newborn babies who require that milk free of cost as a charity. So we are doing that in 50 hospitals across India, in government hospitals. And we see that one of the most important thing that can address anemia, that can address any problem, CDs, NCDs, is mother's milk, breastfeeding. India's current breastfeeding rate, early breastfeeding rate is only 46%. And exclusive breastfeeding rate is 57%. We used to breastfeed more than 75 previously, but because of modernization, westernization, and separation of mother and child, our breastfeeding rates have come down. Milk, breast milk, mother's milk is the magic formula. Previously, because I was taught under allopathic practice, I used to think, what is this Ayurvedic doctors? If we have stomach pain, headache, fever, anything they are talking about, pancha, 5 types of treatment. So all these 5 treatments, they say everything you have to do, vomiting, you have to defecate, you have to put oil and all this. What is this? But most important, if your gut health is not good, nothing else works. Ayurveda is the essence of life. We have realized that 3 trillion neurons are there here, connections are there. More than those number of connections we have bacteria, gut bacteria. And that gut bacteria is established by mother's milk breastfeeding. And breastfeeding is very, very important. And because of westernization, we are forgetting all of this. We are rapidly progressing towards in that direction. So I think breastfeeding, gut bacteria, gut microbiota, our ancient Indian practices, and more importantly, ragi, jaggery, milk that you are providing, this sort of practices are very, very good. I was surprised today, MD SPM assistant professor I met today, I don't know his name, Dr. Praveen, I think. He told, I asked him, do you have lactation support here? Yes, sir. We brought 5 lactation counselors from Mumbai, very well trained. I am telling you, very wonderful job to the SPM department. Excellent that you have lactation counselors. You are starting breastfeeding right at the delivery. So, as part of my NMC, if I would have come for inspection, I would have given 250 seats. But I know you don't want seats. You are not working here for money. You are working here for seva. But this is a wonderful work. I am really blessed. I am really happy, blissful. I am going back with very, very wonderful memories. Especially so many people, you are all doing selfless work. Selfless work. Happiness is in selflessness. And I think this is the greatest bliss we can have. Thank you very much for providing me this opportunity. Bharat Mata Ki Jai.
Thank you so much, sir, for that heartfelt talk. May we now invite Dr. Rajyavardhan Azad, Member Legislative Council Bihar, to address all of us. Dr. Azad currently is serving as the member of the Bihar Legislative Council and is a globally renowned ophthalmologist and a champion of public and community eye health. He is widely regarded as the father of the retinopathy of prematurity movement in India. Author of several books and over 400 research papers, he holds several leadership positions in global medical bodies related to ophthalmology, including the South Asian Academy of Ophthalmology. We request you to please address all of us, sir.
I bow in front of Swamiji, Madhusudan Swamiji, from whose face there is some kind of radiation which comes. When I saw him first, so I was really, attracted to him. So my pranam and respect to you. Dr. Santosh has already spoken. In fact, he has already given chief guest address. So I will be sweet, short and sweet, so that because you people are waiting for a very long time. And Swamiji from Ramakrishna Mission. Ramakrishna Mission has a big role in India in the spiritual, educational, and the cultural values of not only India, but in the globe, all over the world. Bihar and Jharkhand, especially in Devghar, there is a Ramakrishna Mission school. And these schools were, one of the topmost school in South Asian region, which used to impart our culture. The schools are not meant only for, giving you textbook knowledge. Schools are meant to give you the culture, the ethos of the society, the ethics, how to become a good professional, how to become a good leader, how to serve the society. So all these values are imparted in Ramakrishna Mission. The Vice Chancellor of this university, I can imagine his job because it's a big, university. I had a chance to visit there. And also the director of the institute who took me around this, complex. When I was asked by Krishna Mohanji He came to Patna to meet me. I shuttle between Patna and Delhi because, I'm wearing too many hats. So, I keep, shuttling Patna, Delhi, and some other places, also abroad, internationally. So when he came to me, he told me about this Sathya Sai, foundation, and especially about Madhusudan Sai Maharaj Ji. And he told me about his vision. He said, a very intelligent person who has got a vision ahead, at least 40 years, 50 years ahead. So somehow or other, I also have same kind of mindset. Because, see, I was in AIMS for 40 years, good years. I was student there, and then I became senior resident, junior resident, senior resident. Then I became assistant professor, associate professor, distal professor, professor, and then, the director of I Center. But I had a very big vision, See, I have always believed, the doctors are sitting here, and also some of the medical students are there. I always tell that you should do something out of box. If you are eating every day, if you are going to medical college every day, writing books, and seeing patients, that is not your job. Your job is to excel. Your job is to see how you can get a Nobel Prize, how you can make an impact in the world. Why the heart transplant is started outside and not in India? See, I was visiting professor in Guangzhou in China. I keep on going to China very often. And I had my mind, when I was a student, I had in my mind that I will, I was thinking of eye transplant. Nowadays, eye transplant means cornea transplant. But that is not total eye transplant. And total eye transplant, nobody has thought about it. There's some work already going on. If total eye transplant happens, it will envision the lot of blinds in this world. I think recently I saw the stadium, cricket stadium. So there I saw, I think last 2 days, there was an international blind cricket match. So if this happens, there will be no blind cricket match. So this is what I impart. The other thing I say, that as a professional, I am a doctor, somebody is an engineer, somebody is an IT consultant, but your job is to serve what you are giving to the society. You must give something to the society. You must serve the society. A doctor is the one who has the passion, who understands the patient. I have written book in Hindi, I translated in English, that is about my interaction with the patient in AIMS for 40 years. See, when somebody comes to me, what is going in his mind? And when he comes to me, what goes in my mind? Those interactions I have written there. I'll tell you in a small example. I'll just take few minutes, not more. There was a guy who had a retinal detachment. I'm a retinal surgeon. There was a guy who had a retinal detachment. He had only one eye. And he was working in meteorological office in Delhi. He came to me, and he had heard my name. He came to me. I saw him. I said, I think his name was Mr. Thakur or something. And I said, Mr. So-and-so, you have got retinal detachment. Retinal detachment is bad. I don't know what will happen. This guy tells, no, doctor, you operate, I'll be all right. See, this doctor had more faith in me than I had in myself. And next day I saw him. I said, Pandeji, I remember now. Pandeji, it seems that your eyes are not that good, and I don't know about the result. He said, don't worry, you operate, I'll be all right. So, but he put one condition. The condition was that you operate me on Thursday. I said, why? He said he was a follower of Sai Baba of Shirdi. So that thing, in his mind was there. And I said, Thursday is not my day, because my day is Wednesday and Saturday. He said, no, somehow or other you do it in Saturday. Thursday, I consulted the other colleague of mine, and he said and this man became all right. What I'm trying to say is that, the faith and the service you provide, if you serve people from your heart, it doesn't go waste. Never it will go waste. And this institution is an example. The other thing I will say, why I immediately agreed to come here, because about 23 years back, I was in Puttarpatti, and I had a chance to meet the Sathya Sai Baba there. And I had a 15 minutes, interaction with him. I think those days it was very difficult. And those days, when such a hall like this was there, a small room was there, and then so many devotees were there, and he came waving, he gave those vibhutis to some few people and saying met and all. And after that, I was sitting like you people are sitting here. They had given me a pillow. So I sat on the pillow, and then he called me. I went inside, and he talked to me. He talked about my family, wife, my children and all. And he said, you are doing a very good work. I know about you. You see, go and visit my hospital. That time I was president of the National Board of Examination, the board which gives DNB degree. And perhaps you can imagine now, and 23 years back, I was the youngest president of the board and did a lot of things. I don't want to, detail here. But that day, I visited the hospital. The hospital was so neat and clean there in Puttarpatti, and everything was, speak and span. And then he also told me to come to Whitefield Hospital. When I went to Whitefield Hospital, I was amazed to see that such costly gadgets. I think the cardiothoracic is there, the neurosurgery department is there, which is not very easily accessible in India and not very easily available to people who don't have money. So from that time, I was very much amazed. And today, I came, and I was taken to the hospital, and I was amazed to see one thing. And that was, I was told that in 10 days, they could develop a cath lab. It is unimaginable. I can tell you from my heart, it is not possible. And then I saw the picture of Sathya Sai Baba. And later I saw him. I thought that Sathya Sai Baba from above, he is giving all his radiations to him, and he is radiating to all of us. What a wonderful coincidence could be. I was really amazed to see another, that the medical college could be ready in not even a year, 360 days. When Krishna Mohanji said, Dr. Saab, can you think that in how many days this medical college will come up? I said, it will take at least minimum 2 years. He said, less than 1 year, 360 days. So I think there is something divine which is happening here. When I was a medical student, I had read the book, Man of Miracle, that written by some British author. And Swamiji, Sathya Sai Swamiji's mention was there. So I imagine, there's something, it's not possible to start a cath lab in say 10 days. It is impossible. So I think something very divine is here in this place, and which is making all this possible. I don't want to take much of your time. I just want to say, Swamiji, कि स्वामी जी, झारखंड में आपने वहाँ पर एक यूनिट खोला है मदर एंड चाइल्ड का, जमशेदपुर में. तो ऐसा है कि of course recently, I have had a wide experience of the healthcare in the country. Of course, Dr. Santosh is here. So, but before that, I was in medical council, so many other places, WHO, IAPB, and now in our International Council of Ophthalmology. So what I'm saying is that although there's a lot of development in healthcare, health wellness, and specialized centers, but the eastern part of India is a little bit lagging. But Bihar is lagging most. Despite so much of developments in infrastructure and also other areas, of course, healthcare is also improved, but not to meet the unmet need of the people who are there. So, and I know Swamiji is not only a Swamiji, a spiritual guru, but he's a man of action, because I heard from people. और सबसे बड़ी बात है कि जो पता नहीं कैसे जो मतलब कुछ constellation होता होगा, कुछ होता होगा. See, I'm not neither a believer in God, nor I'm a not believer in God. I'm in between. I see as it happens, as it is happening here. So as it is happening here, so I think that he has got something, I do not know what power he has, that whatever he thinks, he sees it is done. अब चाहे जैसे भी हो हमको नहीं मालूम. अब यही बता सकते हैं कि स्वामी जी बता सकते हैं. तो मेरा यही कहना है कि आप कहेंगे तो हम लोग वहाँ पे कर सकते हैं. I think that will be a very wonderful thing. और ज़्यादा से ज़्यादा क्या होगा, बिहार और झारखंड के बॉर्डर पे मेरा अपना ज़मीन है. मेरे पिताजी तो कुछ ज़मीन दे दिए थे हॉस्पिटल के लिए, तो मेरे हिस्से का जो ज़मीन है मैं दे दूंगा इसको. That will serve the bordering area of झारखंड एंड बिहार बॉर्डर पे है. और झारखंड का जो संथाल परगना एरिया है, आई कम फ्रॉम देयर, वहाँ पर जो है वहाँ पर और भी खराब पुअर हेल्थ केयर है. और उसके बगल में तो ऑफ कोर्स भागलपुर है और भी एरियाज हैं वहाँ पे. तो ये हम लोग वहाँ पे कर सकते हैं. तो हम स्वामी जी का ज़्यादा टाइम नहीं लेंगे, आप लोगों का ज़्यादा टाइम नहीं लेंगे. आई एम वेरी हैप्पी टू बी हियर, ऑनर्ड एंड प्रिविलेज. एंड आप लोग जितने भी यहाँ पे डॉक्टर्स हैं, आई अंडरस्टैंड दैट यू आर सर्विंग क्या बोलते हैं, अयंग निज परोवेति गणना लघु चेत साम उदार चरिता नाम वसुधैव कुटुंबकम. देखिए, लव ऑल एंड सर्व ऑल, दैट इज द मीनिंग. मेरा कुछ नहीं है ना आपका कुछ है, सब कुछ जो है ऊपर वाले का है. और ये संसार जो है ग्लोबल है. जैसे स्वामी जी बोलते हैं कि सर्वधर्म है, सब धर्म. एक ही रिलीजन है, देयर इज ओनली वन रिलीजन, दैट इज ह्यूमैनिटी and the service to humanity. Not only humanity, service to humanity is the religion. मैं भी उसमें बिलीव करता हूँ. So मैं ज़्यादा वक्त नहीं लूँगा आपका. आप लोग थक गए हैं, सुबह से भी मीटिंग चल रही होगी, बहुत सारी बात. हम अंग्रेजी में बोलते हैं वर्बोरिया. वर्बोरिया का मतलब होता है बहुत सारा चीज़ सुन लिया, कान में ब्रेन में चला गया, अब वो स्टे नहीं कर रहा है. तो आई विल क्लोज हियर एंड थैंक यू वेरी मच फॉर इन्वाइटिंग मी हियर. आई वुड लाइक टू बी हियर again and again. Thank you very much.
Thank you, sir. May we now invite Swami Sathya Gyanananda ji to address all of us. Swami ji currently serves as the Adhyaksh Maharaj of the Sri Ramakrishna Mutt, Chennai. Having assumed the role in August 2024, he formerly served as the secretary of the Sri Ramakrishna Children's Home in Chennai and has been instrumental in leading spiritual retreats and community welfare programs, including the centenary celebrations of the Mutt's charitable dispensary. Swamiji.
नमश्री यतिराजाय विवेकानंद सूरये सच्चित सुख स्वरूपाय स्वामिने तापहारिणे. My namaskars to Sadhguru ji and other dignitaries on the dais and the delegates from all over India who is doing wonderful service, and the students and the doctors assembled here. Actually, I have come here to take something for our centenary dispensary. But I found here, I have come to a place where everything is in abundance. Here love is abundance, service is abundance, and the students are looked after in all respect, holistic education. That side Gurukula is there, this side advanced medical facility, and everything is given free. And these students are coming as volunteers at their advanced age, or sometimes they come in middle ages also to serve this institution and the society. So our Swamiji, Sadhguruji is doing really a wonderful work for the public and for the individual. The central doctrine of the Ramakrishna Math and Ramakrishna Mission is Atmano Mokshartham Jagat Hitayacha, meaning one's own liberation and the service of the society. So in the modern days, many youths are attracted towards that and becoming monks of the order and volunteers and delegates and serve the society. Here, all the students are motivated towards that. All volunteers, very sincerely, they are looking after the patients. When two volunteers were guiding me through all these things, I told, you are giving a very royal treatment to me. Then he told, you are all representation of God, that is why we are giving royal treatment. But later I found all the patients are receiving the royal treatment. It's not a joke. Here, real service is done as worship. That's what Swami Vivekananda taught us. Regular service, whatever professional service we are doing, if we do it in a service, that worshipful attitude, that becomes yoga. That takes you nearer to God or nearer to self-realization. Here, I found all the volunteers, doctors, even the staff members are having that worshipful attitude toward the patients and the students also. So, somehow, our Sathya Sai Baba has given some message to our Sadhguru, and you all students have got a very nice role model. Kindly emulate his life and you become thousands of Sadhguru like him. And Swami Vivekananda told, give me 100 youths of high caliber, I can transform the world. Here only one person is doing some global changes. So you are, it's a nice example for you, all the doctors and the students. Because of service, we serve the society. In that process, we also elevate ourselves. Definitely, what Rishi Munis achieved in the forest or wherever they have done the spiritual practice, same thing can be achieved by doing the service. We become more and more unselfish. Our ego gets universal, and really that is the goal of our Sanatana Dharma. So this institution is promoting all these things. So definitely the people living here are very blessed. So I thank the opportunity for giving me to address you all people. Thank you.
Thank you, Swamiji. We would now like to offer a token of our love and gratitude to all the dignitaries for taking time out and sharing their heartfelt insights with all of us. Swamiji, thank you so much. Our love and gratitude to you. Dr. Rajavardhan Azad ji, thank you, sir. Dr. Santosh Kumar Kraleti ji, thank you, sir. On behalf of all of us, we pray to Sadhguru to bless us with his divine message.
Om Sarve Bhavantu Sukhinah, Sarve Santu Niramayah, Sarve Bhadrani Pashyantu, Ma Kaschit Dukkham Apnuyat. On this very special occasion, when our Sai Swasthya, Sai Arogya, Sanjeevani, and our hospital teams have all converged here in this place to understand, deliberate, and recommit ourselves to the cause of universal health care. I am extremely glad to receive such eminent people in the ashram who have stood for this cause of service and spirituality, starting with Honorable Swami Satyanatmananda ji from Ramakrishna Mutt. Your special blessings to all the delegates as well as to the students is truly appreciated, and we look forward to doing whatever we can with the mission in Chennai and elsewhere also. I must tell you that Sri Vivekananda Swamiji, of course Sri Ramakrishna Maharaj, they all have been very inspirational influences in my life as a person as well as in the lives of so many of us over here. And I think it was the Ramakrishna mission which was established by Swami Vivekananda ji that talked about service as the expression of spirituality. Before that, most of the matas were not doing that. There was only religion was being taught, rituals being practiced, and spirituality was just a theory. But it was Sri Vivekananda ji whose vision, especially in India that was reeling under so many social evils and colonialism, that he brought this idea of uplifting the mankind, providing them with food, providing them with what they lack, be it bread, be it health, be it education. And so this mission has served, and I'm sure if the life expectancy has improved from maybe 30s to 60s or 70s today, it's because of not just the government but also missions like these and many more who have contributed to the welfare of the society. I'm also very grateful to the chief guest for his heartfelt talk, Dr. Rajavardhan Azad ji, and his spontaneous offering of opening a center for the needy and the uncared for people in his own area. So you are a true son of the soil because you feel for your people and you want to do something about it. So ज़रूर कुछ ना कुछ करेंगे. आपने यहाँ कर कहा है. मैं हमेशा कहता हूँ कि ये सत्य साई ग्राम की भूमि सिद्ध संकल्प भूमि है. यहाँ पे जो भी संकल्प हम शुद्ध मन से लेते हैं वो ज़रूर हो जाता है, वो पूरा होके ही रहता है. तो ये मेरा पावर नहीं है, ये किसी और का पावर नहीं, ये एक मन की शुद्धता का, पवित्रता का ये एक प्रमाण है कि जो भी हमने यहाँ पर निष्काम भाव से सोचा है, कोई भी सेवा का कार्य जो हमने यहाँ पर लिया है वो अपने आप ही पूर्ण हुआ है. क्योंकि निस्वार्थता में जो शक्ति है, प्रेम में जो शक्ति है, वो किसी और में नहीं। तो यही इसका प्रमाण है ये सब जो आप देख रहे हैं। तो आप इतने निस्वार्थ भाव से प्रार्थना करेंगे तो बिहार भी सिद्ध संकल्प भूमि बन जाएगी। आई एम श्योर समथिंग गुड विल कम आउट ऑफ इट, एंड so we'll look forward to that. And of course, Dr. Santosh, for your generous appreciation for our work, coming from a member of the National Medical Commission, which is the apex body which controls and governs the quality of health education as well as healthcare delivery systems, works close to the Ministry of Health, and implements the vision of the National Health Mission. I'm sure these words are not mere words for us, but they are kind of certificates of some kind, where we appreciate how deeply you have understood the system and how you have also appreciated our vision to actually give high quality both medical education and medical care to the most underprivileged and in a way forsaken communities around the country. I am also wanting to let you know that we are truly a global organization, Vasudhaiva Kutumbakam, as the Prime Minister has said. We are here for the whole world, not just for our people, because I am Nijaha Paroveti, that doesn't work here. It is all us. So we have a hospital in Fiji, which was inaugurated by the Prime Minister, Honorable Prime Minister Mr. Modi, along with the Prime Minister of Fiji in 2022. This was online, he inaugurated the Children's Heart Hospital. So also we have a hospital in Sri Lanka, in Nigeria, in the US. I just came back from Malaysia. We did a heart mission in Penang, and some more work is going to start over there. So truly this is a global system of healthcare, and yes, Indian doctors, nursing and medical workforce is going to serve the whole world in the coming times. And that is because India has that vision. India always had that heart to serve the world. So yes, what you said would definitely happen. And since you mentioned the name of the Honorable Prime Minister and his vision, Ayushman Arogya Mandirs, which are everywhere, which are the same model as Sai Swasthya clinics. And I'm sure that we have a lot of scope to work together and complement each other, so that whatever government is trying to achieve, we are trying to achieve, it works for the country, it works for the people of the country in the true sense. So we are so open to working together. I also would like to let you know that a lot of state governments are coming forward to ask us to manage the state hospitals. And in a short while, we will be signing an MOU with the government of Assam. Because I was there in Assam, and the Chief Minister happened to come to the event which we had invited him for. And a few discussions happened. So both nutrition program for the whole of Assam, almost 45 lakh children, and we're taking up a hospital, which is a secondary care hospital near Guwahati, for the sake of a collaboration between the government and us. And we would manage the hospital. That's a partnership between the government as a 50-50 partnership, with which we would be able to provide these high quality services. But what is interesting is that the Chief Minister did not just appreciate the service part of it, he appreciated the culture. He said that if you people come, you will culture our doctors and nurses and medical graduates to become like you, to become not just competent but compassionate healthcare workers. That is something that he also appreciated. So slowly the world is waking up to this understanding that no single person can solve all the problems. It has to be a collaborative effort. It has to be a partnership. And that partnership is something that we're looking forward to. Sai Swasthya today, which is the main reason why we are all here, it's a simple idea. Don't let anybody fall sick. Before they fall sick, you take care of them so that they don't have to go to the hospital. Because any number of hospitals we build for a population of 140 crores, which will be 150 crores in a couple of years, you cannot solve the problems with a population which is both ways. It is NCDs as well as CDs, as he mentioned, especially NCDs. That's becoming a pandemic right now. And this is really very worrisome, because I travel around the world. I've seen the countries who failed to arrest NCDs and how they're suffering now. Their efficiencies, their productivity, everything has come down. And it is a cost to the economy, and as a growing country, we cannot afford that calamity. So intervening at the right time, be it nutrition at the school level, which will help them to grow into healthy future citizens, or early detection of diseases and preventive work, promotive work, whatever is there, I truly believe that if we all work together, there would be a day when Sarve Santuni Ramaya would be achieved. Because they would never be going to the hospitals because before itself they have been well looked after. But should there be a necessity, there are these tertiary care facilities also available. Secondary care centers are coming up. They are available for the people at no cost because health is not a privilege, it's a fundamental right. And that's something, again, I heard from the Prime Minister. Not many Prime Ministers have said that in the world, that health is a fundamental right. But he said that, not he just, he said that he put it on some standees in one of the events somewhere in Assam only again. And I was very thrilled because nobody says it that health is a fundamental right, because the moment a government says it, it has to provide it. And most of the governments cannot provide it. Even if I go to the US, there is a whole huge missing middle as it is in India, stuck between the Medicaid and Medicare programs. They're not so poor to get government help. They're not so rich to pay it for themselves. But these are the people who shift from APL to BPL every year. It's not just in India, it's across the world. In the US, it is quite stark. And I feel for those people as well, whose lifetime savings disappear because of one health catastrophe. And this is why we think that preventive health care is the future, with technology at our disposal, with better diagnostics, handheld devices, with telemedicine and the internet, that the government has done a fantastic job of providing internet, high-speed internet in rural areas. All this is coming together to make this vision happen. I think 10 years ago this was not possible. But today it is more possible than it was 10 years ago because of all the interventions government has done in the last 10 years. Amazing work in terms of Ayushman Bharat, the largest universal health system or coverage, health coverage for the country. 50 crore plus people are covered under Ayushman Bharat. Of course, there is that 40 crore missing middle which is not covered, and that is where we also are working to promote the idea of good health and health-seeking behavior in the rural and the middle-class communities. So this is all the, of course, my request is that you have to increase the healthcare expenditure, the budget and the healthcare expenditure for the population like us. Can you believe in a country like Fiji has $120 per person, and we are at, I don't know, $8 or $7 per person? That's all we are spending. That's not at all something that is appreciated, because for a country of this size, which is a young country, must be healthy, must be productive, must be efficient. Health is a primary need, and I think in $8, you can't even do a whole diagnostics for a person. Even if you want to make a preventive, let us say that dollars we spend only for preventive care, even then it won't be fully sufficient to do one annual full health checkup. So somewhere there is a need for increasing the budget and also making the budget work by right collaborations and partnerships. Our idea to produce medical professionals is simply to promote this idea of wellness. I believe that these doctors, nurses, paramedics from this hospital, this college will be the future healthcare leaders, not just healthcare workers, and they would lead the healthcare system of the country and the world in the right direction, which is competence with compassion. And we have many people, कुछ लोग तो बिहार से भी हैं कि नहीं, बिहार से भी है ना कई लोग? कौन है बिहार से? खड़े हो जाओ. Just stand up. How many of our medical students are from Bihar? Not तुम लोग तो ये प्रोफेसर, आप यहाँ से मेडिकल स्टूडेंट्स में कौन है? बिहार, झारखंड, यूपी. आई कांट सी गेट अप. ये एक है यूपी से है, वो है बिहार से. यूपी बिहार से हैं कुछ लोग. सो वो आइडिया इज दैट उनको ट्रेन करके वापस वहीं भेज दें ताकि वो उधर के पॉपुलेशन की सेवा करें. द आइडिया इज दैट दिस बिकम्स अ काइंड ऑफ अ नर्सरी वेयर this kind of talent is nurtured, and then they are sent back to their own areas. They serve their own populations. I was just listening to a very nice a discussion in Times Now in Hyderabad, which was happening between 4 top healthcare institutions, all private. And they were talking about why they would not enter the tier 2 or tier 3. What are the difficulties, what are the challenges, why they cannot go and work for a Sai Arogya or a Sai Swasthya center. And one thing one of them said is that it's because of their wives, it's because of their spouses. Why? Because they would say, where will our children study if you go to tier 2 city or a tier 3 city? There are no proper schools, there is no proper infrastructure, there is no entertainment, there is no social life. So there are many other requirements which have to be fulfilled in order to make these doctors, nurses go and work in those smaller towns. The other option is that they themselves are from the smaller towns, so they naturally go back to those towns. They're used to it. Second, they have not paid for their medical education, so they don't have to worry about earning it back in a corporate city-like setup. So these are the ways we are trying to solve this problem of how to take health workers or health professionals back to tier 2, tier 3 cities, and not just allow them to gravitate towards the greener pastures of corporate medical care in the cities, urban areas. So that is also an intervention we thought of, and that's why this medical school and nursing and paramedical colleges have come up, that these children will go back to those smaller towns and smaller rural areas and will contribute to their well-being. These are all the policies related stuff, but for coming back to Sai Swasthya, they are from 9 states, I believe, Shubhajit would tell me. They are from 9 states, so they speak different languages. And one of the biggest thing that is needed for being a good healthcare professional is that you should speak the language of the patient. If you speak English in front, like what I am doing, in front of a Telangana or a Bihar or a West Bengal patient, and nothing will go inside the patient. First of all, there is no bonding, there is no connect. So why Sai Swasthya is important for us? Because you are right there in their backyard. You speak the language that the patient speaks. And that is why you have a connect and bonding. You can understand the problem of the patient better, and you can provide them right kind of counseling and guidance. And this is a unique challenge with India, which is not there in most of the other countries. In India, we speak, I don't know how many national languages or recognized languages, a few, but hundreds of local colloquial dialects are there. And you must speak that. Only then the patient is able to connect with you and is able to feel your concern and respond to you. So सबसे ज़्यादा important आपकी भाषा है. So Sai Swasthya ka one of the biggest strength, apart from the clinical understanding that doctors will tell you all the protocols and processes, सबसे बड़ा इसका strength है कि आप वो भाषा बोल सकते हैं जो patient, जो आपका मरीज़ भी बोलता है. यदि आप उसकी भाषा में बात नहीं कर सकते तो वो मरीज़ आपकी बात नहीं समझेगा, और वहीं पे आधा हेल्थ केयर ख़त्म हो जाता है, क्योंकि केयर चला जाता है उस हेल्थ केयर से. जब आप उसकी भाषा बोलते हो तो आप उसको अपना बना लेते हो, और ये इज समथिंग दैट साई स्वास्थ्य कैन अचीव. इसीलिए इट्स इंपॉर्टेंट दैट वी कीप ऑन ओपनिंग सेंटर्स इन द रूरल जियोग्राफीज using the local talent, people of the local area who can speak the language, explain all the medical terminologies and all the problems in their simple language. So patient can appreciate what we are trying to do. So आप लोगों का बहुत बड़ा, apart from you being doctors, nurses, paramedics, your ability to speak their local language is something that I feel is a strong point for all of us. अभी तो सिर्फ 25 सेंटर्स हुआ है, आते आते 100 सेंटर्स का इस साल के अंदर, नवंबर के अंदर हमारा प्लान है. और आप हर एक जो है एक दूसरा सेंटर खोलिए तो अपने आप ही वो 2 सेंटर हो जाएगा एक से. तो आपके जहाँ पर आप लोगों का सेंटर है उसके आसपास में देखिए, एटलीस्ट फ्यू विलेजेस अपार्ट एक और सेंटर आप खोलने की कोशिश कीजिए. सो दैट इज़ द फास्टेस्ट वे वी कैन गो टू द 100 सेंटर्स एंड 1 million screenings, which is very much possible. According to me, nothing is impossible if we set our mind to it. But I think if you can just do this, you would save the country a huge healthcare burden. हम लोग tertiary healthcare afford ही नहीं कर सकते हैं. यदि हम सभी हार्ट अटैक के पेशेंट्स होने लगे, विच इज़ बिकमिंग अ कॉमन प्लेस थिंग नाउ, या सबको स्ट्रोक्स होने लग गया, सभी को ये कैंसर होने लग गया, सबका ट्रीटमेंट करने चलेंगे तो हमारा आधा GDP उसमें ख़त्म हो जाएगा. मतलब बाकी चीज़ों के लिए पैसे ही नहीं बचेंगे, या फिर वो लोग मर जाएंगे. दोनों में से एक ही होने वाला है. या तो आपका देश कंगाल हो जाएगा, या फिर आप जनता मर जाएगी. तीसरा कोई विकल्प ही नहीं है हमारे पास. बस यही विकल्प है कि वो होने से ही रोक दें, प्रिवेंट इट फ्रॉम हैपनिंग. इसीलिए साई स्वास्थ्य इज सच एन इम्पॉर्टेंट प्रोजेक्ट फॉर मी, फॉर द इंस्टीट्यूशन. Yes, medical schools are good, the big hospitals are good, the tertiary care, health care, pediatric hospitals are good, but सबसे बड़ा contribution देश को कोई दे सकता है, even more than this medical college, is this Sai Swasthya program. That is why it has to succeed. So it depends on all of you. తెలుగు వాళ్ళు కూడా ఉన్నారా ఇక్కడ? బాపట్ల నుంచి వచ్చేవాళ్ళు ఉన్నారు, ఎక్కడ ఉన్నారు తెలుగు వాళ్ళు? చాలామంది ఉన్నారు. తెలుగు దేశాల్లో కూడా వాళ్ళ భాషలో మనం మాట్లాడితే కానీ వాళ్ళకి అర్థం కాదు మనం ఏం చెప్తున్నాము. అందుకనే అక్కడ ఇప్పుడు బాపట్లలో ఒక చిన్న హాస్పిటల్ ప్రారంభమైంది. అయినా కానీ ఒక హాస్పిటల్తో ఇది సరిపోదు, కనీసం అది ఒక ఆంధ్రలో ఒకటి, తెలంగాణలో ఇంకొకటి. ఇప్పుడు అలాగా మనం కొన్ని ప్రదేశాల్లో చేసి మీ దగ్గర, మై ఐడియా ఇస్ దట్ ఫర్ ఎవ్రీ 100 Sai Swasthya center, let us have 1 Sai Arogya to begin with, so that they can be referred to the secondary care center. అది కూడా కాకపోతే అప్పుడు మీరు టెర్షరీ కేర్ ఇక్కడికి తీసుకురండి. బట్ ట్రై టు సాల్వ్ ఆల్ ద ప్రాబ్లమ్ అట్ ప్రైమరీ అండ్ సెకండరీ లెవెల్. డోంట్ అలౌ ఇట్ టు ఎస్కలేట్ టు ద టెర్షరీ లెవెల్. ఇంత పెద్ద హాస్పిటల్ వచ్చే అవకాశమే రాకుండా మీరు చూసుకోండి. అంటే పేషెంట్ని అక్కడే బాగా చూసేసుకుంటే వాళ్ళకి ఇక్కడ రావడానికి వాళ్ళ ఆవశ్యకత ఉండదు. కాబట్టి మీరు చేసిన పని వల్ల చాలా ప్రయోజనం అవుతుంది ప్రజలకు. సో ఇట్స్ వెరీ ఇంపార్టెంట్ ఇంటర్వెన్షన్. I can speak a few more languages, but I'll avoid that for now. ಕನ್ನಡದವರು ಇದ್ದೇ ಇರ್ತಾರೆ ನಮ್ಮ ಈ ಸುತ್ತಮುತ್ತ ಈ ಕರ್ನಾಟಕದವರು. ಸೊ ಸೇಮ್ ಮಾಡೆಲ್ ಎಲ್ಲ ಕಡೆ ನಾವು ಅದೇ ಸೇಮ್ ಮಾಡೆಲ್ ಇಂಪ್ಲಿಮೆಂಟ್ ಮಾಡ್ತೇವೆ. ಅವರ್ ಐಡಿಯಾ ಈಸ್ ಟು ಸ್ಪೀಕ್ ದ ಲೋಕಲ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಆ್ಯಂಡ್ ಕನೆಕ್ಟ್ ಟು ದ ಪೇಷಂಟ್, ಎಕ್ಸ್ಪ್ಲೇನ್ ದ ಪ್ರೋಟೋಕಾಲ್ಸ್, ದ ಮೆಡಿಕಲ್ ಪ್ರೊಸೀಜರ್ಸ್ ಬೆಟರ್ ಆ್ಯಂಡ್ ಓನ್ ದ ಪೇಷಂಟ್ ಆ್ಯಸ್ ಅವರ್ ಓನ್ ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್. ನಮ್ಮವರೇ ಅಂತ ಭಾವನೆ ಇರಬೇಕು. ಯಾರೋ ಬಂದಿದ್ದಾರೆ, ಯಾರೋ ಪೇಷಂಟ್ ಬಂದಿದ್ದಾರೆ ಅಂತ ಅನ್ಕೋಬಾರ್ದು. ನಮ್ಮವರೇ ಬಂದಿದ್ದಾರೆ, ನಮ್ಮ ಕುಟುಂಬದ ಸದಸ್ಯರು ಬಂದಿದ್ದಾರೆ. ಅಷ್ಟೇ ಪ್ರೇಮದಿಂದ, ಅಷ್ಟೇ ಪೇಷನ್ಸ್ದಿಂದ, ತಾಳ್ಮೆದಿಂದ ಅವ್ರನ್ನ ನಾವು ಹೇಳ್ಕೊಡ್ಬೇಕು. ಅವಾಗ ಏನಾಗುತ್ತೆ, ಸಮ್ಟೈಮ್ಸ್ ಯು ಆರ್ ವೆರಿ ಪ್ರೆಷರೈಸ್ ಬಿಕಾಸ್ ಯು ಆರ್ ಡೀಲಿಂಗ್ ವಿತ್ ಟೂ ಮೆನಿ ಪೇಷಂಟ್ಸ್. ಯು ಕ್ಯಾನ್ ಲೂಸ್ ಪೇಷನ್ಸ್, ನಾಟ್ ಪೇಷಂಟ್ಸ್, ಆ್ಯಂಡ್ ಇನ್ ದ ಪ್ರಾಸೆಸ್ ಪೇಷಂಟ್ಸ್ ಆಲ್ಸೋ ಯು ವಿಲ್ ಲೂಸ್. ಬಟ್ ದ್ಯಾಟ್ಸ್ ಸಮಥಿಂಗ್ ದಟ್ ಯು ಆಲ್ ಹ್ಯಾವ್ ಟು ಮೇಂಟೈನ್. ಅವರು ಓದಲಿಲ್ಲ, ದೇ ಆರ್ ನಾಟ್ ಎಜುಕೇಟೆಡ್, ದೇ ಡೋಂಟ್ ನೋ ಎನಿಥಿಂಗ್, ದೇ ಮೇ ಬಿ ವೆರಿ ಡಿಮ್ಯಾಂಡಿಂಗ್, ಸಮಟೈಮ್ಸ್ ದೇ ಡೋಂಟ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್, ದೇ ಮೇ ಬಿ ವೆರಿ rigid and even rude because they are anxious, they are suffering, so naturally they are not in a pleasant state of mind to deal with you nicely. But in all those times you have to maintain your patience, that they are our family member, they are not well, they can be at times difficult, but you have to show a lot more love, and that way you will become a better human being, not just a better medical professional. So idella ide, but I believe that after Annapurna program, which I call it as a revolution in nutrition, and today it is serving 1 crore children every day, and in couple of months it will be 1.5 crore children daily. I call it as a revolution. It is some kind of a kranti in the field of nutrition, and Sai Swasthya is going to be the next big revolution for the country, a kranti of its own kind. So this is what you are a part of, and be very proud, be very honored to be a part of something like this. We have just begun. We want to make 6,000 centers, one in every taluka. That's still a long way to go. But to everybody who is a part of this initiative, from the medical college, directors and staff and faculty, to all the faculty and members of Sai Arogya, Sanjeevani, Sai Swasthya, to all those volunteers who come, they give their time, their energy and their skills, they support this. To everybody, I convey my heartfelt regards and gratitude on behalf of the patients that you have served. And that is something that is changing lives, making a difference to them, to the country, to the world at large, and you are doing transformative work. May Bhagwan's blessings be always with you. He is the first person who pioneered the cause of free health care. And when I was coming, ये आपके लिए है आज़ाद जी, मैं छत्तीसगढ़ में पैदा हुआ हूँ. And first time when I was crossing Puttaparthi to go for my entrance exam, for writing entrance exam for my BSc course, when we passed by the super specialty hospital, I asked the guardian who was with me, what is this? And is it a palace? And the guardian said, no, this is Baba's super specialty hospital. It serves patients for free. 1996, May. That was my first impression. What? Hospital like this can exist, which can treat patients for free. How nice it would be if there was one in Chhattisgarh like this in Raipur. And we built in Raipur in 2012. And it is functioning today. That is the Raipur hospital picture. Government of Chhattisgarh gave us the land. We built the hospital and a huge center, an auditorium, and all the quarters and everything on a 30-acre campus. There's also skill building programs for nursing and paramedics there. So my thought that when I entered Puttaparthi was, why should we not have such a hospital in Chhattisgarh where people are suffering without health care? And आज आप आए, आपने कहा बिहार में क्यों ना हो ऐसा अस्पताल. शुद्ध मन से हम कोई भी संकल्प लेते हैं तो वो ज़रूर सिद्ध होता है. May that also happen. May many more hospitals happen. May many more such centers happen around the country. May this Indian idea of Sarve Santu Niramaya materialize, manifest in our own lifetimes in front of our eyes. And that is the India that we want to create, where nobody is hungry, nobody is sick, nobody is uneducated, nobody is unsheltered. And if there is one, the society is there to look after them and provide them. That is the kind of India we are dreaming of. That is the kind of India our ancient ancestors, our sages and seers have dreamt of. And with that, once India is on track, I'm sure the world will also fall into place. Every one of us will serve every other person in the world. And the world will be a better place to live in. With these words, and as उन्होंने क्या बोला, वर्डोपिया, क्या बोला आपने? वर्बोविया. बहुत सारे बातें आपने सुनी आज, you have heard a lot of things. I hope you retain all these things to some extent in you. But most importantly, your compassion, your care, your concern, your love for the patient is the soul of this mission. Everything else is, around it. But the core is your personal passion to serve the sick and the needy. And with these words, if you remember at least this last sentence, that is good enough for today. I will see you all tomorrow, and I want to hear your versions, your stories, your experiences tomorrow. So we will be spending some time tomorrow afternoon to listen to your part of the story. So till then, blessings to everybody who's a part of it. Have a good night's rest, and we will see you tomorrow again.
As we conclude session 2 of the All India Sai Swasthya and Sai Arogya meet, we request all our dignitaries on stage to come forward for a group photograph. Thank you very much. We request all the delegates to assemble tomorrow morning at 9:15 a.m. at the Atai Shaw Hall for session 3 that shall focus on point-of-care diagnostics, technology integration, and health innovation. Thank you, and Sai Ram.